Otoplasty, ear reshaping. Is there a surgical solution? My ears are in the correct position. They do not protrude, but when viewed from the front, the top of both ears curves out in an unnatural way. I'm not sure what is causing this. Underdeveloped superior crust of the antihelix? And if there's a surgical solution?
Thank you for your question. You submitted 2 photos of your right ear, one from the front and one from the side. And you ask in your question about the ears protruding, and particularly the upper part of the ear protruding when you look from the front, and you're asking about your options. Well, I can certainly give you some guidance into how I assess people who are concerned about prominent ears. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and dealing with prominent ears is a part of the practice of cosmetic surgery, and I can certainly share with you my approach and experience. So to begin with, in assessing a person who is concerned about prominent ears, there's actually a very systematic way to approach this based on the anatomy of the ear that could potentially benefit from correction. So we look at the ear basically into thirds: the upper third, the middle, and the lower. The upper third being what we refer to as the helix, antihelix part of the ear. The middle, which is where the ear canal is, and is an area called the conchal bowl. And the lower part of the ear lobe, which is called the pinna. So when you look at yourself and you notice that the upper part of the ear is protruding relative to what you like, then looking from the side, I would say that a way to look at this is to say that you have something called an undeveloped antihelical fold. And what that means is essentially there's a crease inside the ear, which is a fold that allows the upper part of the ear to be turned inward. And in terms of the relative position, there are some absolute guidelines, or I should say a range of guidelines as to how much of a distance there should be for each part of the ear from the scalp or from the skin. And then there's also the aesthetic appearance that the surgeon and the patient basically work on together. So in developing the antihelical fold and developing that crease, essentially it's a surgical procedure, and it's a variation. It falls under the broad category of a procedure called otoplasty. So briefly, it is essentially a procedure that in our practice we do under local anesthesia. Sometimes we give people some sedation, but basically it's a pretty straightforward procedure in terms of the approach, which is from behind the ear, inside the crease in the back of the ear. And what we do is create a fold by placing sutures. And the sutures are often referred to as mustarde sutures, and it's placed in a way so that when those sutures are tied, the ear folds over and creates that crease. And that's done from behind the ear, so there's no external obvious incision from the side or from the back, really, because it's inside the crease. So it's a very nice and elegant procedure. There's always risks and benefits to every surgery, and the usual concerns about infection or bleeding are always there. But I think that this is a relatively straightforward procedure for you. Of course, you also have to think about what you think the ear looks like once it's folded in, because sometimes people will not realize that they don't want their ear to be so far back, as well as maybe try to be just kind of in line. So it could be kind of subtle. So that's something that should be discussed with a surgeon once you move forward with doing a consultation, and that's what I'm recommending. Find qualified, experienced cosmetic surgeons who perform otoplasty and have this discussion and see who you feel comfortable with, and I think it's well worth considering. So I hope that was helpful. I wish you the best of luck, and thank you for your question.